Good day, everyone, and welcome to our webinar. My name is Hiba Jabarti from Saudi Patient Safety Center. You will be hearing a presentation from Ms. Makia Madrashi. She is a patient safety specialist in the Saudi Patient Safety Center, and Mr. Abdurrahman Al-Malki, Assistant Director General of Patient Experience Center in the Ministry of Health. Also, Mr. Khalid Al-Harbi, he is a Patient Experience Patient Experience Measurement Program Manager at Ministry of Health. And our last speaker is Ms. Hala Al-Muez. She's a Patient Experience Director, Patient-Centered Care Director in Prince Mohammed bin Abdulaziz Hospital. They will be speaking to us about patient empowerment for policymakers. We will start our presentation with Ms. Makia Madrashi. She has a Master of Business Administration in Total Quality Management from the University of Leicester. She is working in the Patient Safety Center. She is a certified in strategic planning professional, key performance indicators, and balance scorecard, change management program, and crisis and disasters. Ms. Makia has over 20 years of experience in the healthcare sectors, including accreditation and name projects. Now, moving along to our session, please welcome with me Ms. Makia.
Thank you, Hiba, for your introduction and having me today. Thanks to you, our participant, and hope we will all enjoy our session. Starting with our webinar objectives, we are going to discuss the importance of patient empowerment in healthcare system, and we will identify the different levels and domains of patient engagement at individual, community, and system, as well as discuss the strategies in patient and community engagement and outcomes. And by the end of the session, we will know what are the main role of leaders and policymakers in empowering patients and their families. Then we will conclude our webinar with lessons learned from national and international initiatives. So, as a warm-up, we are going to start asking you, how far did you engage your patient and families? And I'm seeking the help of Hiba to launch the first poll, please. Starting, thank you. So could you just participate in the first poll? The question is, do you engage patients and their caregivers, families in your work? There is no correct or wrong answer, so it depends on your culture and on your facility. If you have some, you can say, yes, I feel confidence about engaging patients and families. Somewhat, I know it's a good idea, but I'm not so sure to engage a patient effectively. But you might heard about this concept the first time. So this is a new term to you, and you could seek support to start this journey. I'm encouraging all our participants to participate in the first question so we could know and explore. Even if you are still a student, I think you could just have your point of view. So one Ragat from the chat said, some of us, we are still student. It's okay just to know if you are visiting a hospital, how do you think about engaging patients and their families? If we get enough number of participants, Hiba, could you launch the polls, please? Okay, quite interesting. So we have almost similar percentage that 33% they feel that they are confident of engaging patients and families, and some it's somehow and somewhat, and some of the participants, this is still new to them. So promising that this session will be an amazing session. We will participate all in knowing a lot of strategies how to engage patients. starting with the concept of patient empowerment. Since we have students and new people knowing this term is for the first time, so the concept of patient empowerment is the process by which people gain control over the factors and decisions that shape their lives. It's a process by which they increase their assets and so they can build their capabilities to gain access, partners, network, so they have active role and they can participate in their healthcare. Moving from this huge, complicated system, sometimes we know that it's not easy to implement patient empowerment. Why? Because the concept of harm is not because of the frontliner, it's because of the complicated system that we all faced in our day-to-day work. It's not easy, as we said, but to move that from complicated system, we have to know how we can move on. So this slide shows the draft of Global Patient Safety Action Plan from WHO 2021 to 2030, which provides strategic direction for all stakeholders, leaders, how they can move and how they can have actions, how we can implement the patient empowerment. It's really quite interesting if you could have a look at it, that it has a focus, fourth strategy about engaging patients and their families that we have to look at. Policies and procedure, disclosures, how we can have patient advocate as well as education. Why do you think we have to engage patient? It's really the right things to do. Why it is the right things to do? Because if we are partnering with patients and their families, they show respect, values, and their insight will give them empowerment so they can have their voice and their concern heard. Why it is the safe thing to do? Patients usually have different perspective. And when they have different perspective, they will show and they will behave safe. It will give creative solutions. Why? Because they can see things from other perspective and from their own point of view. It is an expectation of the standards. All the national and international standards, they require a patient engagement in all the chapters, in all the levels, whether it is for leaders, middle management, and as well as frontliners, including patient. Why we still talk about patient engagement and patient empowerment? Because it has a great impact on patient empowerment and on patient safety in a lot of aspects and areas. When we talk about safety, we care about medication management, hand hygiene, how we can promote and encourage incident reporting. So all these will affect the patient safety, as well as the other aspect, which is patient and family-centered care, coordination of care, equity, health outcomes, and etc. So when we mention that we really care about engaging patients and families, and we have to include all the levels, not only individuals, we mean by the community, as well as the system. We know that this is still new in our healthcare system, whether national or international, so we may vary in implementing the patient engagement or patient empowerment. Some of us could just sit with the patient, so they are still in the phase of inform. So they just give the patient the information so they can take a decision. So this is the really minimum level of the engagement. They're only providing the information, while the second level is the consult, where you can give patient the information, then listen to them and provide them feedback, how they can speak up and talk about their concerns, which really affect their decisions. The next level is involving, where patient and healthcare providers, they understand the values and beliefs that so they can reach to similar approach, and the decision will be taken according to the patient perspective. The upper level is the collaborate, where the patient and the healthcare providers, they can identify the alternatives and they can have a prepared solutions together. The last level of engaging patient is the empower. And this is what we hope all the healthcare sector will reach. where the patient can have the decision and he can control his health life. Now, back to you, Hiba, to continue the session with my colleagues.
Thank you, Makia. Now we will be moving to Mr. Abdurrahman Al-Marki. He is the Assistant Director General at the Patient Experience Center with extensive experience in patient care, customer service, and patient experience. He earned his master's degree in public health from King Saud bin Abdulaziz University for health science and patient experience leadership certificate from Pearl Institute and qualified trainer from Saudi Commission for Health Science. Abdurrahman has participated in establishing the Saudi standards for human-centered care. Please welcome Mr. Abdurrahman Al-Marki.
Thank you, Hiba. Good evening, everyone. Assalamu alaikum wa rahmatullah. Actually, it's my pleasure to be here today and talking to you about efforts and projects that we have done in Ministry of Health to support the patient empowerment. First of all, I would like to thank you all for attending this session, and I hope you will enjoy and find this valuable source of information. Also, I would like to thank the Saudi Patient Safety Center, Ms. Hiba and Makia, for organizing this session and in giving us the opportunity to participate with you and showing you our experience in Ministry of Health regarding the patient empowerment. Here I'm going to talk about the efforts that we have done in Ministry of Health to support the patient empowerment and how we engage them to be part of the healthcare provided. So as the Ministry of Health has an obligation or have an obligation to provide safe and comprehensive healthcare services, this is true to consider the patient perspective point of view when we providing the services. So we have strengthening our part by strengthening the communication tools with the patient to give them the opportunity to engage and participate in developing the health services. One of these projects that I'm going to talk about today is the call center 937. I think most of the participants from Saudi Arabia, they heard 937 because they have seen this number in the pharmacy, even in the private hospital, in the public hospital, in the waiting area, and everywhere in health facility. So we are putting that to reach the patient voice. So the call center, one of the projects to facilitate the access to healthcare services. So the center receive patient complaints, opinion, and comments regarding the services. So they provide these services for 24/7. The center provide consultation services through specialized doctor, which make it easier for the patient or the community to get service rather than going to the facility and wait for time to get the medical advice or consultation for mild or cold cases, especially at night where most of the public primary healthcare centers is closed. So patients, they just need to call this number and get a consultation. Also, the center can provide appointment services. So patient can book an appointment at the nearest primary healthcare center anywhere across the country. And the center, for these services they provided, create a huge transformation in our health system by facilitating the access to health services. Adding to that, the center provide us with the KPIs that we need when we initiate a project or when we initiate some initiatives. So we are using the center as a source of data and source of information which reflect the patient's perspective toward received health services. Therefore, the center, they have 4 principles that they are using to manage and put their services at good and excellent way. The center serves as a listening ear to the patient need, the quick response to meet the patient medical needs, especially for patients who need transfer to advanced hospital or for patients in urgent cases. The center also implemented the high quality standards to meet the patient medical needs. And also the center used the data to guide the improvement. As you can see here in the pictures at the right hand, that the center in the last month achieved the Silver Award in the best customer serving for his outstanding services, which contribute in improving our healthcare services. Another project that we have in Ministry of Health, we have a national e-health strategy. This initiative has been created by the Ministry of Health to consider, which considered as a primary transformation agent and enabler. So the MOH developed a national e-health strategy to support its goals through connecting with the providers, also to care for patients, to transform healthcare delivery to a consistent and world-class standard through the providing safe and high-quality healthcare services. Also to measure the health care performance. Here are some of the projects that included in the e-health strategy, which is Sihhati app or Sihhati platform. The Sihhati platform has many features that enable customer to have immediate consultation through the app by chatting with the doctor. Also, they can send a picture or video, or can make a phone call or video call with the doctor to get the consultation. After that, the customer will receive a prescription regarding his condition if needed one. Another feature that the platform provides, that patient can book an appointment for himself or his family at the family medicine clinic, at the vaccine clinic, child clinic, also at the dental clinic. Also, the platform provides virtual clinic for people with chronic disease or those who need a routine appointment. They can book appointment with their hospital. They don't need to come from a distance, like those people who live in rural area and they need advanced consultation. From this, the platform enables people to get a quick response services. They don't need to come, as I have said, to wait for time at the door of the clinic, especially those, as I mentioned, in the rural area. As you can see here, also we have some brochure about to educate people about the services in Sihhati platform. My doctor, the vaccine record, and also the child appointment. One of the huge transformation projects in Ministry of Health is the Patient Experience Center. The MOH has defined the patient experience as a comprehensive personalized care to patients and families delivered by proud, engaged healthcare heroes. So we here encourage the partnership with the patient. So our purpose in the Patient Experience Center to create national excellence in a patient care through effective partnership. If we have effective partnership, we will have patient engaged, empowered to improve these services with patient families and caregivers. So we have a promise in the Patient Experience Center to be a human-centered care facilities for all patients. So all hospitals and facilities in MOH should follow the Saudi standard for patient-centered care, and we will elaborate more in this project. Here are the scope of services that we are doing in Patient Experience Center. We empower beneficiaries in decision-making or customer through the capturing their voices by the call center and the PX officers. Also, we use the comment in the PX measurement program where the patient can deliver their concerns regarding the health services. Also, we empower them through the representative at the Patient Family Advocacy or Patient Family Advisory Council. And we will elaborate more about these two projects, which will have a huge impact if we implement it in our facility. Also, we advocate for patients and families through publishing the guidelines and mechanism that we think will have impact on healthcare providers and the patients as well, like the patient Bill of Rights. We have launched the Bill of Rights, and we have also launched the complaint management guidelines to make sure that people, to make sure that we advocate for them. We are their voice at the Ministry of Health and the facility. Also, we engage beneficiaries in designing and redesigning the services through evaluating and measuring the health services provided in hospital and all healthcare facilities under the MOH supervision. Also, we introduced the concept of person-centered care, as we have published the Saudi standard for person-centered care to promote the empathy practices and values, which has impact to empower and engage patients in our improvement and in our development for health services. Here are some initiatives that support the patient empowerment. This initiative has been done by the Patient Experience Center. We have the Bill of Rights, we have the complaint management guidelines, we have the Patient and Family Advisory Council at hospital, at regions level. Also, we have Patient Experience Measurement Program, the Saudi Standard of Human-Centered Care, SPCC. We will elaborate more about these projects we have done, and we are still continue doing this project. The complaint management guideline is the complaint or patient view regarding the healthcare services are valuable source of information and provide an opportunity to improve the provided health services. So as I mentioned earlier, that we have created some tools to capture the patient voice. Therefore, it is essential to build or create an effective mechanism or guidelines to handle the patient complaints. So the purpose of this guideline is to work as a reference for the complaints handling officers to ensure the fairness and transparency with the patient. Also to become a document that we can update regularly basis. Also to become a source on directing beneficiaries on how or whom and when to lodge a complaint, and also a source for us to know what is the gap and the challenges in our health services. Here's the Bill of Rights, as we believe in the patient's right, as well as empowering and involving them in decision making, which support and improve the provided health services. We have committed ourselves to clarify the rights to the patient who receive our services. So we have the general rights here. Also, we have defined the rights based on or classified the rights based on on some categories like age, gender, and health conditions. We have pediatric patient rights, elderly patient rights. Also, we have rights for people with disabilities, cancer and infectious diseases. They have their rights, and people with mental health issues, they have rights, and women health rights. Here I captured two of the general rights that empower patients and engage them in our health services, that to ensure the patient aware of all information related to their status and condition, so they have the decision regarding their condition. Also, the presence of educational materials that provide guidance for patients, like in nutrition, in manner that qualifies them to deal with the patient's health condition inside and outside the facility. We are empowering patients to take control over their own health, so not only in hospital, but also in their home. Also, we have done some campaign that's encouraging and engaging or supporting the patient empowerment. We know that the healthcare providers is the core principles here to provide the health services. So one way to encourage patients to be proactive and engaging them is showing them interest and speak their language. So we have this campaign which was targeted to the healthcare providers. So we have initiated this campaign, which called Ihsan, to promote employee about the excellence communication skills with patients. In this card, we can see that we remind the healthcare providers about the principle of communication with patients. They should provide these services with a smile, showing empathy. They also need to explain the procedure and why patients need to wait for a time in front of the clinic. Also to answer the patient questions, showing appreciation to the patient and explain the next step. All these things we think will have improvement and will have impact on the patient. Also, we have seen that through the patient experience measurement program, the communication is one of the way that will improve the healthcare services and will increase the PX measurement score. Then we have a Touch of Empathy campaign to promote the engagement and the communication with patients. We have used the social media like Twitter, Facebook, and LinkedIn. Also the internal communication by sending emails to the healthcare providers. These brochures that reminding them how to deal with patients and how to encourage them to get or support them to be part of the decision regarding their health condition. Also, we believe that motivation and incentives is one of the tools to increase staff participation with patients. So we initiate initiatives to recognize those employees who have outstanding professional services performance based on patient evaluation and comments. I think Mr. Khalid, inshallah, will elaborate more about the comments dashboard we have, and there's a chance for patient to appreciate some of the staff that has deal with him. Also, we recognize those leaders and facility who have successful story that impact the patient services. I have talked about some initiatives that we have been considered in Ministry of Health. Next, inshallah, my colleagues will elaborate more from the ministry level and the hospital level. Back to you, Hiba. If you have any questions, you can just write it in the Q&A and we can answer it later on after the end of this session, inshallah. Back to you, Hiba.
Thank you, Mr. Abdulrahman. Now we will be moving to Mr. Khalid Al-Harbi. Mr. Khalid has a master's degree in primary healthcare. He is in nursing from Sydney University. Currently, he is leading the patient experience measurement program and supervise the person-centered care unit. He is interested in the person-centered care concepts and the best ways to implement its principle nationally. Please welcome Mr. Khalid.
Thank you, Hiba. Thank you for having me today, and also my thank extended also for our audience who joined us this evening. Thank you all for joining us. So in the next few minutes, I will be talking about some of the strategies we are working on here in the Ministry of Health through the Patient Experience Center to promote and facilitate this the patient empowerment and family empowerment, which is one of the tools to improve the patient safety at the end and improve the patient quality and thus the patient experience. So first I will so here it's a kind of like saying how to empower patients from our perspective here in the Patient Experience Center. So we believe that the regulators has a big role here. They really have a big role. They have all the authority, all the power to set the ground for such an important tool that will work not only to improve the patient experience, but before that, improve the quality and patient safety. So as I said, the regulator has a big role here and to set the ground and make policies to create an active community of patients, patients who will participate in their care plan and also become a decision maker by themselves, per their own right. So no, I think we will not argue and the importance of the patient empowerment and engagement. There are countless studies and many studies who talk or calculated their studies about how positive was the work when we reach the point when we engage the patient and enable them to be an active agent in their own care and the care provided around them. So also from a regulator point of view, we think that to empower patients is to provide them with the tools. We need to provide them with the tools. After we provide the policies, after we provide the regulation to give the green light or put all the, we need to put the tools here. And there are many tools that we are, we think that will work in this direction. Also platforms like the Patient Experience Measurement Program of the PXMP is one of the tools that we believe that will give, especially in the individual level, it will give the patients who receive the care from a facility or a hospital or any type of service, even the applications, all sort of care that is provided to patients will be on the radar of the Patient Experience Center through the eyes of patients. So we provide them with the surveys and provide them with the tool to put their voice and voice their perspective about the care they receive. Also, to empower patients, we need to provide them with the information. Patient without information or family member without information can't be engaged. They can't engage in something that they have no information about. They can't engage in their own care if they have no information, or they have, or let's say a lack of information, or something goes through the communication between the healthcare providers and the patients or their companions. So we need to do this. We need to provide the tools, platforms, and information to gain the valuable role, or to have the valuable role that we seek from the patient side. Through our journey in the Patient Experience Center, and we have had a number. Mr. Abdurrahman goes through a couple of initiatives, and here I will elaborate more in some of them. Patient and Family Advisory Council. It's one of the strategy, or one of the way to provide, let's say, the community level of engagement, the community level of empowerment. We empower the community or patients from the community who being served from a hospital to engage in a dialogue with the hospital, executive hospital leaders, and sit on the table together with them to share their decision, to share their desire or their expectation from the facility. Then I will talk also later on about the implementation of patient or person-centered care concept within our healthcare facilities. We recently have started this concept a year ago, so we will share our experience on this regard. Then I will talk about the measurement of patient experience, the patient experience program, the PXMP, which is will allow the feedback, suggestion, and patient perspective about the care that they receive. Then I will end up by talking about the empowerment of patient companion. We have an initiative 2 years ago to empower the patient companion and take it to a higher level, and we call this a patient or the care partners initiatives. So first, I will talk about the patient and family advisory council. I believe that we came across this term before. What we mean here is it's a council that consisted of patients or a representative of a patient, like a family member, or a past or a patient who been in the past or interacted with this facility services before. So those group of patients will join the PFAC, or the Patient and Family Advisory Council, together with the rest of the hospital board, the director of the hospital and the rest of the board in the hospital. So that they all come together, sit together, and work on things that will improve the quality of care provided. The patient and patient representative will be, or the voice of those individuals will be heard by the facility, the hospital board. Also, there is another kind of PFAC that goes on the regional level. On the regional level, there will be also another type of patient and family advisory council that looks to a higher or more or broadly on the healthcare system that is within the region. So the patient and family advisory council we believe that will improve the patient's patient experience at the end of the day, but also before that, improve the outcomes. Through our experience, since we start implement this kind of council years ago, we believe that there are a few things that we need to consider during those type of meetings. And one of them is making sure that participants, either patients or their family or family representative, understand the council purpose. It's very important for them to understand that that their role will enlighten the healthcare leaders within the facility or on the region in improving the healthcare. Setting goals has to go, or has to be together. These goals has to be set by taking in consideration all the point of view from the other side, from the side of community, the side of patients. So we need to set our goals, and these goals has to be clear for all members of the PFAC. Regularity, it's really important. We need to show our members, especially patients and their family members, that we are I wouldn't say serious, but that we are committed to hear their voice, and that their voice shaped the healthcare provided, or services provided by the hospitals. We need to make sure that the participation of all members is guaranteed, starting or beginning from making the meeting agenda, through the discussion and the decision, the positions that we all, or the whole members have the right to set the agenda and to participate in the discussion, and also has their voice being heard once we decide upon something. One of the things that sometimes patients could come and say that they feel in some occasions that the authority plays a big role here when during the discussion, sometimes patient feedback could go through like, or could become like, they could say things like, we don't feel that, or we could feel the authority is playing a big role here. So we need to make sure that there are no type of being or leading the agenda, leading the discussion, or by somehow influencing the decision comes out of the PFAC. We need also to follow up on all projects raised by a council. And one of the good way to do this is to make sure that member of the team is one of the patients or patient's family member, to become a kind of like or to put like oversight on the agenda and make sure that all projects are on the right track. Hopefully, report all the outcomes of the PFAC meetings. They need to be reported, and agenda, brief about the discussions and decisions that be made, projects that has come out of these councils has to be announced. And also, as any of the projects, we need to regularly assess the PFAC and whether it's achieved or does it achieve its goals or no. We can do this through measuring the regularity of our meeting, measuring the involvement and participation of all the members in the meetings. This is one of the things. Also following up on the projects. And next we will talk about the patient-centered care. It's one of the topics that we all hope to achieve in our healthcare facilities and healthcare, in our hospitals. It's one of the way to make to empower patients. We need to have I wouldn't say a minimum, but a fair. We need to at least fairly achieve a number of the patient-centered care principles, the dignity, preserving the dignity of the patient, preserving their rights, preserving, making sure that they are participating in the care they receive, they engage, they are being given, or they being given the right to participate. The right information at the right time to those patients to make a decision about their condition, and also being empowered by providing all the because, as I said before or earlier, no patient with low or lack of, if there's any lack of communication, any issue with the information or the flow of the information from the patient or the healthcare provider to the patient, that will seriously affect the engagement of our patients. The patient, we need to set a standard. We need to make a standard that covers the principles of patient-centered care. We need to build our teams in each hospital, in our facilities, teams that, or its aim is to make sure that the standards are being or implementing the standards within the healthcare facility. Training the team, also it's very important. Leadership involvement is crucial here. We need to gain the involvement. We need to gain the involvement of the leadership here to achieve the patient-centered care. Empowerment, we will not reach the empowerment without patient engagement, without patient participation. The outcome or the desired outcome is to improve, as I said earlier, improve the quality of the healthcare quality and patient safety. And later on, or the result will be improving the patient experience. So a couple of years ago, we started our journey with the patient-centered care through alliance with one of the international entity. Then we came out with a standard after the experience we had with the international organization to build our own person-centered care, the standard that covers all the principles. Here we stand on the healthcare transformation program. The healthcare sector transformation is one of a number of programs emerged from the national our nation vision to 2030, and the nation or the 2030 vision, the healthcare sector transformation, person-centered care or people-centered care, human-centered care is being mentioned, and the team believe that creating a system that is a person-centered will assist us in reaching our goals. So before that, we have scattered of initiatives targeting the implementation of the person-centered care principles. So we put all those initiatives together. The initiatives that achieve the target or achieve the principles, the 4 principles of the person-centered care. And then we group those standards, we create those standards and put them under domains, a number of domains, to ensure the implementation of person-centered care on all hospitals. Our aim to ensure or to implement the PCC in all the hospitals. Patient engagement and empowerment were manifested in our Saudi person-centered care by PFAC, the Patient and Family Advisory Council, is mandated there. And also the access of information in all levels, and also participating in the care plan. Healthcare provider also, we know that they are the driving force in this matter, so we will make sure that their participation or they were being empowered to fulfill our task. Patient experience measured program, and here I'm exceeding my time. I will try to speed up here. Patient experience measured program is one of the program we rely on here in Saudi Arabia. It's a national program. We measure the patient experience. So it's measured there after once any of the patients, or once any patient utilize the services, SMS or a phone call, after a couple of days will reach him or her, and a survey. So they will have the right, and they will have their opportunity to participate in those surveys. Those surveys has a comment section, so participant can provide a really valuable suggestion, feedback, and sometimes compliment about the services they receive. Those comments are being analyzed using artificial intelligence tools. So we will have a good way to analyze those comments, find improvement opportunity, and build improvement projects there. So we try to speed up here. There are a number of initiatives that came up because of the comments that the patient provides. So somehow their influence was there in the care partner initiative, visitation policies has been, or we have created a visitation framework that is more flexible and meet the needs of our patient. Meal guidelines. Care partners, as I said earlier, we were trying to move or to increase or put some responsibilities for the companion of patients, or call them, and then we will call them care partners. We need to call them care partners because as we know, care partners provide a lot of positive things on patients. They provide comfort, psychological support, and also sometimes help the healthcare providers to understand some of the needs that in some occasion patient can't express. To establish a care partner or a good care partner initiatives, we believe that organizations should set a comprehensive and flexible criteria for patient to choose a care partner. The policies include care partner organization responsibilities. It has to be embedded there, suitable for the care partner, these policies have to be suitable for care partner to participate in the patient's care plan. It has to have a privilege to the care partners, also education materials to arm the care partners with the knowledge and skills to later on, once the patient being discharged, play the care partner or care partners at home. And here, if we create a care partners who has a knowledge and skills to provide a good care for the patients, that will somehow play a positive role in the patient's safety. The patient also has always the right to not have a care partner, change the care partner, or limit and increase the participation and responsibility. This table will show you how the comparative between the companion and care partner. Companion or sometimes are passive, whereas the care partner are active. Limited responsibilities for the companion, and a wide range of responsibilities for the care partners. I would like Ms. Hiba to share this question with you, and I am encouraging you to share your opinion about the challenges that may face the implementation of some of the strategies that I shared with you. We feel like we share some of them, like leadership support, staff resistance, patient and family awareness. And you could mention any other challenges. Thank you, and back to you, Hiba. Back to you, Hiba. Okay. So I can agree with all of you in terms of leadership support. We really think that the leadership support is crucial here. Staff resistance and patient family awareness are almost the same or equal. Yeah, almost 50% goes to the leadership support. I can agree with you here. Thank you very much. Thank you. Back to you, Maki.
Thank you, Mr. Khaled. Now we will move to our next speaker, Ms. Hala Moez. Ms. Hala is a senior audiologist with a master's degree in advanced audiology from the University College of London. Ms. Hala is the Patient Experience Director and the Person-Centered Care Director at Prince Mohammed bin Abdulaziz Hospital. She is certified in change management and had a successful experience in leading the Plaintree certification program, focusing on patients and family engagement and empowerment at Prince Mohammed bin Abdulaziz Hospital. Please welcome Ms. Hala.
Thank you, Ms. Hiba. Good evening, everyone. First of all, I would like to thank the Saudi Patient Safety Center for giving us this opportunity. And also I would like to thank all the participants for taking the time and attending this session. So today I'm gonna share with you our experience in implementing some of the strategies to promote patient and family engagement and empowerment at Prince Mohammed bin Abdulaziz Hospital. This will include some of the challenges and lessons that we learned. So here's my outline. I'm gonna first talk about the importance of patient and family engagement. And then I'll share with you PIMA's journey, or Prince Mohammed bin Abdulaziz Hospital's journey with the PCC certification, including the provisional scores, corrective actions, and marketing plan. And lastly, I'll talk about the impact of these practices on the patient experience measure. So why person-centered care is important, or why it's important to involve the patients, engage them, and empower them. Simply because it has been proven that these practices lead to improvement in clinical outcomes, improve the quality and patient safety, increase the patient and family satisfaction or patient or guest experience. It will also increase the staff satisfaction. What does the person-centered care cover, or what does it include? It covers first staff, caring for staff, and then patients and their loved ones, family or caregiver, and also the community. So it's not limited to patients only, but also it covers staff as well as the community. In our hospital, we were relying on the 5 main drivers, plenary drivers in excellence and person-centered care. These drivers, as you can see in the slide, the first one is creating organizational structure that promote engagement, which includes initiating or forming the PCC steering committee, assigning a PCC director, the PFAC, also focusing on the physical environment by minimizing the barriers and so on. The second is connect values, strategies, and action, providing cohesion between what we do and why we do it. This involves integrating the PCC goals in the strategic and operational plans, leadership, accessibility, and interaction with staff from different levels. The third and one of the very main drivers is implement practices that promote partnership. And this driver promote active involvement of patients and families in the plan of care, including different points and different levels. I'll go through these in the next few slides. The fourth driver is knowing what matters, which is providing personalized care to the patient and their family or care partner, understanding and documenting their goals and personal preferences and trying to honor them. And lastly, using evidence to drive improvement in collaboration with staff and patients. So I will not go through all of these points, but as you can see on the left side of the slide, these are the 5 main drivers, and under each driver there are several criteria. Under each criteria there is measurable elements, but most, if not all, of these criteria are focused on the patient and staff engagement and empowerment, such as here, if we can take a few of these criteria. The first one is improvement structure or process relies on partnership between leadership, staff, and patients and family to identify and improvement efforts. The built environment incorporate elements that support patient-family engagement in their care. Next, in the driver number 2 is PCC goals co-developed with patients, families, and integrated in the strategic plan. The driver 3, as you can see, it's all about implementing practices that promote active involvement of patients during their stay in the hospital. The fourth here is care planning processes include elements aimed to ensure care plans are aligned with patients' documented choices or goals. So these were our guide throughout this journey. So our journey started in September 2021, and honestly, it wasn't a good story or pleasant story to share or tell. Basically, because of this, these were the only numbers that we had at the beginning of the journey. We had, for example, in driver 3, 4.5 out of 32. In driver 5, we had 5.5 out of 32, which is equal to only 30% of the total score. And this is very far from even the lowest recognition level. So on top of that, we had only like 3 to 4 months to close up everything and to be prepared for the site visit. In fact, there were some negotiations and trials to stop this process, believing that we don't have the potentials or capabilities to drive change and move on. Considering the challenges that we had or the gaps, this includes but not limited to the cultural beliefs, staff resistance, patients' level of education and background, etc. However, we decided to take it as a challenge and move on. And since then, we were working restlessly to achieve this goal. But to achieve the goal, we have developed several corrective actions to aid in the course correction. And during the first few weeks, we followed the commanding leadership style, like do and act, to ensure that things are done in the right and timely manner. The first corrective action was division of labor to increase efficiency and facilitate compliance. So the work has been divided to multiple groups. The second was resuming all the PCC suspended activities. Third is developing quality improvement and patient empowerment projects. 4, setting deadlines, and 5, holding regular meetings. I will elaborate more in this session in this corrective action, which is improvement and patient empowerment project. As you can see in this picture, here are the groups with their leaders discussing the current practices and trying to identify improvement opportunities. All the PCC related activities has been reactivated. This includes the PCC steering committee. What does this mean? This committee, it involves staff from different levels like supervisory, non-supervisory, clinical, non-clinical, frontliners, different specialties. And the main members of this committee are patients and families. So we have patients, families, and this committee is chaired by the CEO. The main objective of this committee is to oversee and assist in the implementation of PCC practices. Initially, we used to meet every 2 weeks, like twice a month, to make sure that all the PCC practices are implemented as intended. Later on, we started to hold this meeting and rounds on a monthly basis. As you can see in these slides, we have patients, we have families, and we have staff from different levels chaired by the CEO. We discuss different things, including the strategic and operational plan for the hospital and trying to integrate the PCC goals within the plan. It's not just meetings, it includes also rounds. So we do rounds to the inpatients and outpatients to make sure that the PCC practices are well implemented. Since we have our patients with us, the patient and family members, we issued them a badge. I'm sorry, it's in Arabic, but this badge has the hospital logo, the member's name, and the title, which is the PCC steering committee member, and the name. Those patients and families will act like secret shoppers and visit different departments, different wards, and check on things, make sure that PCC practices are implemented, and they will take notes and record their observation and bring it to the meeting so we can discuss it. So we empower them by providing them by these badges, and one actually of the members has requested this. He said, like, I feel I have the authority if I have something like a badge. We said, okay, and we provided all of the members. The second PCC activity is the PFAC, or the patient empowerment strategy is PFAC. So we have activated our PFAC, or Patient and Family Advisory Council, which also includes also patients, family members, and staff from different levels. The aim of this council is to come up with different improvement projects, try to identify improvement opportunities, and work in collaboration with the patients. It's just not like they bring the idea or share with us their idea and leave the room. No, they will be engaged in implementing all of these corrective actions or improvement projects. The challenge here was, from our experience during the first few meetings, the patients are not really used to such things. So they will just provide the problems or the complaints. So they provide sometimes even personal experience, personal complaints. I didn't have this appointment, or this didn't went as planned, or so on. What did we do is to provide education materials, to provide clear explanation. It took us a few sessions or meetings for them to understand the concept behind of this council. One of the patients, we had to place him in the staff retreat, which I'm going to explain about it more, to understand more about the concept of the PFAC and what we really need from them. The third activity is the staff retreat. It's just like a coaching or an experience that helped the staff to connect to the PCC and understand the patient perspectives. So it's like a coaching or education activity about empathy, compassion, engagement, patient engagement, and empowerment. So we managed to cover up to 95% of our staff. So it's a mandatory activity. We arrange it with the department heads to send their staff to attend this activity. In November 2021, so a few months after, we resubmitted our application for review, and this is what we got. Yes, there is significant improvement. However, this is not our goal or target. We knew that there is a room for improvement and some points to be addressed. So we developed or worked on different improvement and empowerment projects. First and foremost is policies and procedures. We have created and revised up to 20 policies and procedures to be aligned with the PCC standards and ultimately empower patients and families. These are some of these, but not limited to: patient care partner, end-of-life care, nursing handover, visitation policy, shared medical record policy, plan of care, multidisciplinary patient and family education, care of vulnerable population, recruitment policy, patient and family right, reward and recognition policy. So the second was activating multiple channels to record patient experience. We believe that the most valuable and valid input about the service or anything is will be from those who will use it or benefit from it. So that for this purpose, we have activated several channels. This include the physical or paper, digital or QR codes, telephones, emails. Even we have assigned a patient experience representative to help those who are illiterate to record their experiences and fill up the form. Also, instead of being passive, we created an orchestrated methodology to regularly gather quantitative and qualitative information from patients during their stay. And these data will be regularly analyzed and reviewed for improvement opportunities. So these input will inform our decision and improvement efforts. This is one of the booths that we established to help or facilitate recording patient experience. Third is the multilingual support group or the internal staff translators. We believe that communication is vital in everyday life, and it's even more crucial when it comes to relaying health-related information. It has to be very clear and accurate. So to better meet the diverse needs of the community we are serving, we have developed the multilingual support group. They are PIMA staff working with us, but speaking different languages. So they were gathered and oriented, and we took their approval to participate in this project. We managed to have more than 20 languages, such as Chinese, Spanish, French, Turkish, Russian, sign language. So if we have a patient who is speaking different language than Arabic or English, anyone can call any of these staff through the internal system to call them for interpretation. Next is developing or creating reader-friendly materials for patients and families. So most of the policies that we have created, our patient wouldn't know about. So we created these materials that will be provided upon admission for every single patient. I have a sample of the reader-friendly materials, such as the plan of care, the care partner, what is care partner, what's the role of the care partner, shared medical record. So by doing this, we are encouraging and empowering the patient that you have the right to access your real time medical information, the nurse bedside shift report, and also patient visiting time, palliative care, and end of life. So some of the reader-friendly materials will be provided based on the individual case, but most of them will be provided to all patients. So these are the reader-friendly materials in all the wards and provided to all the patients upon admission. Also, one of the tools that we're using in our hospital is the communication board. This board is installed in every single room. Next to each bed, there is a communication board which has the physician's name, the nurse name, the patient's treatment goals, what do they need to learn about, the expected discharge date, the plan for today, the medication time. And we regularly encourage the patients to participate and look at this board and to write their questions, concerns, goals, whatever they have. So this is one of the empowerment tools that we're using with our patient. The other tool is patient's own treatment goals. We in Prince Mohammed bin Abdulaziz Hospital have this practice. It's not the physician or the care team who make the treatment plan by themselves. It has to be in collaboration with patients. So the patients need to write down their goals or to share their goals and wishes with the physicians or the care team, and to set and to make the plan of care aligned with their goals. So we have developed this tool, the treatment goals form, and it's distributed also to all patients, and they are encouraged to write down their own goals and to check if it's shared or not, and if it's shared, whether it's met or not met. So physicians, the team every morning or every day during the round will routinely check on these forms and discuss the goals with the patients. The second form that we used, or the second tool, is the patient's note form. So we enable our patients to contribute notes, comments, or questions as part of their medical record. So they will write whatever they want the healthcare providers to look at. And these forms will be uploaded in the system, so all can access these in the patient's electronic file. The next tool is shared decision-making tool. We encourage the surgical and medical departments in collaboration with the health education department to come up with shared decision-making tools based on the common cases or common diagnoses that we have in our hospital. So one of the tools that we developed is the TB. It's just an example, but it will help the patients to make the right decision, offering them the pros and cons of each option or choice. The next tool is the patient preference card, or to know what matters to the patient. This card will be filled up upon admission by the nursing services to document what's the patient's preferred meals, bedtime, bathing and grooming, the care partner, and so on. And all of these will be honored as possible. One of the initiatives is the quiet time. We have we try to make the environment friendly as much as possible by making by minimizing the noise in the corridors from 11 p.m. to 5 p.m. We have also these signages, do not disturb signages that can be placed for or used for the single bed rooms. So there will won't be a lot of interruption unless there is something necessary. Otherwise, it would be eliminated. Patients can choose their meal type and time during their stay at PIMA. So we have the QR code. The patients can scan this code and select their meal. Of course, those who are on a regular diet, as well as their care partner. They will select the type and the time of the meal, and when do they want their meal to be served. Last, the Patient and Family Resource Center. We have created this resource center to provide support or to support individual access to information. So this resource center can be accessed by patients and their caregiver or care partner. In this center, there is TV, telephone, computers with free internet access. Patients can search whatever they need. There are different books, education materials, different games, coloring books, playing cards, puzzles. So it's just like a business center for the patients and their care partners. Also, we have private counseling rooms for patients who are in shared rooms. They can use this counseling room to discuss different things with the physicians or the care team. Since PCC cares not only about patient but also staff, we know if we have a happy patient, a happy staff or happy caregiver, this will give us happy patients. So we have worked on different projects to increase staff satisfaction and engagement. One of these is the fun zone. We have did some improvement work in the staff lounge and shared this with our staff by email. That research shows that positive mood in work environment or workplace has many benefits, include improve health, improve productivity, boosts job performance, and eases stress. So have a break from your usual work and visit the fun zone. So this is the fun zone for the staff in PIMA. We have added some games, vending machines, some activities or entertainment tools, coloring books, and the good thing here in the staff lounge that everything has been done in the staff lounge was in collaboration with the staff themselves. So we have this QR code in the staff lounge, and we encourage our staff regularly to share with us their feedback. So one of the feedback that we got is we need charging stations. So we provided these charging stations for them, and later on they decided that they want to change the paint, the color, paint color, and then they wanted some, so we changed it to white. They wanted some more activities. We have created this interactive wall for them and some other activities. So the key thing here is being so responsive to the staff comments or feedback, as well as to the patient. Next is the health promotion. This is for both staff and patients. We have the walk track. We have different motivational quotes throughout the hospital. It's in the walls, the stairs. We have the staff private room, even though we have the staff lounge, but sometimes the staff lounge, it's in the ground floor, for example, and sometimes the staff in the ward, they have just 5 or 10 minutes. They want to, they are stressed out. They want to just sit alone for 5-10 minutes. They have this room. It's in every single ward. We have it. It's called the private room. It has stress balls, some coloring books, some quotes about mindfulness. It's not a very big room, but I think it's good room. The next is stress management clinic. Stress management clinic was activated for all staff. They can come as a walk-in as part of the employee clinic. This is the stress management clinic, and we have this is the waiting area. So this is to provide emotional support for our staff. This is the stress clinic from inside. We have also one of the initiatives is the happiness calendar. We have created this calendar. It has nothing to do with any scientific activity. It's all about happiness, such as the Happiness Day, Women Day, Smiling Day, different, events or activities, chocolate and photo booth day, some contests. And we shared this with all staff. Culture of appreciation, the coffee week. One of the other initiatives that we specifically assigned for the night shift staff, we distributed these resilience kits with the tag "Thank you, Pima Superhero," and these were. It has different tools for. It helps with to relieve the stress for staff. It has some tips, resilience tips, and stress balls. And these were distributed by the CEO of the hospital and top leaders, as you can see in these pictures. Here, celebrating the international days with the support of leadership, they always initiate these things. So this will definitely promote the staff, increase the staff satisfaction and engagement and retention. One of the key and main things is the leadership support. So several memos were released to increase staff engagement and empower staff and create motivating environment. The first one is the open door policy for the CEO and all the top leaders and heads of departments, and also the contact CEO email, so staff can share their ideas, their concerns, suggestions, whatever they have directly to the CEO, and all of these will be treated with all privacy and confidentiality. Pima staff has voice to make decisions. So the leadership, they routinely access the perspectives of staff from all sectors of the organization through the open door policy, as mentioned, and departmental meetings, leadership walk around, and patient safety walk around. Also through the educational activities and during Eid and celebrations, they will be always present and interacting with staff from different levels. So going back to our journeys, in December 2021, we've resubmitted our application, and that's what we got, 95%. At this time, our focus was shifted from documentation evidence to ensuring that this is this reached to all staff within all the staff within the organization. So we developed a structured marketing plan. This includes the physical one, including the link team. The link team is include staff from every single department within the organization. They serve as ambassadors to relay or disseminate the PCC related practices and standards to their departments. Also, we have the mobile booth. It's a mobile booth weekly running. Every week we move to different place. For example, OPD, main lobby, first floor, second floor. And in this booth, we will be talking and trying to educate the staff about the importance of implementing the PCC practices, engaging patients, engaging family, and its impact on quality and satisfaction. Also through social experiments or playing different scenarios through education lectures and campaigns and interactive corners. Here are some pictures about the mobile booth and the staff coming to us to know more about the patient and family engagement. This is the contest and prize. We ask every week for 1 quarter. We were asking the staff about PCC related questions, and we have every week we will have 2 winners. So this was the poster for the contest. This is the poster or invitation for the educational lecture. Please join us to learn more on how we have successfully transformed from a system-centered to a person-centered organization. And this is a picture of the educational activity. This, the invitation for the campaign that we had in collaboration with, so we try to involve as many as we can from the departments, nutrition services, HR, social services, patient support services, the PFAC, health education, customer care, nursing affairs, and medical affairs, because it's not just one department who can make this successful. Patient involvement and empowerment, it's from the very beginning to the end of their journey throughout their stay in the hospital. So these are some pictures of the campaign and some of the giveaways. As you can see on the right hand, we have displayed the PCC related policies, so they are known to all the visitors. Some of our patients who visited us in the campaign, and here are some of the giveaways. So we try to pass the messages even with the giveaways, provide care with compassionate interaction and caring attitude, assess the patient's role in decision making, treat patients with respect and dignity. The second part of the marketing was digital through the emails, screensavers, main screens, and sharing the PCC related policies by email. So these are sample from the electronic or digital messages that we shared with staff, and this one as well. Okay, so at some point we wanted to assess the level of compliance. We wanted to make sure that these are really implemented and all the staff are aware about these practices. So we announced a random round for all departments and wards to evaluate the extent of the implementation of the PCC practices with all the leaders. We tend to use during the rounds this assessment, compliance assessment form, in which we ask patients, did the healthcare practitioner introduce themselves, the name and specialty? Did they discuss with you the treatment plan? Did they communicate with you in a language that you understand? Did they ask about your treatment goal? Did the nurse involve you in the daily bedside shift report, etc.? So all of these engagement and empowerment questions are asked to the patients, and we see if it's implemented or not, and there will be a report will be sent to the department head based on the input. During this journey, it wasn't only the patients or staff, honestly, who are seeing and feeling the difference. It's also the Planetree themselves. So we keep receiving feedback and positive comments about the continuous evolution of the team and the significant improvement in the application. It was during a short period of time. However, we had this goal and we managed to do it. It's not impossible if you have the desire to make the change. So these are our score in comparison to the first submission. So eventually, by the end of the quarter, we achieved 100% on implementing the PCC practices, mainly about the patient and family engagement. The impact on patient experience measure, I'll just go quickly over these. So we have a set of data here, or a set of questions, related to communication. As you can see, explanation about what would happen during tests and treatment, degree to which nurse ask your permission to perform tests, explanation about upcoming tests. As you can see in the orange color, there is an improvement compared to the last year prior to the implementation of the patient and family engagement and empowerment tools. The second set of question about engagement, explanation about what would happen during test and treatment, staff efforts to include you in decision about treatment, meaning using shared decision-making tools. And also we have a clear improvement and significant in some of the points. And talking about shared decision-making tools, as I shared with you an example, the TB shared decision-making tool, we had one improvement project that was conducted by the Infection Control Department, and in which they used this tool, and their goal was to minimize or the reduce of the length of stay. And the result was here, as you can see, 10 out of 36 patients, or which equals to 28%, were discharged early. So this means that this tool is really effective. The third set of questions is about courtesy, and attitude. And these are the data of 2021, and these are 2022 data. And as you can see, there is a clear improvement, especially at certain points. The last is about visitors or family accommodations or and comfort of visitors. Also, there is some improvement. I think it's after modifying the visitation policy. Here, I would like to share with you some of the comments or messages that we got from our patients. I'm sorry, it's in Arabic, but I'll try to post the key value behind each message. So this one is about quality. The second one is about providing or addressing the medical and humanities need, especially the humanities. The third comment is about the caring attitude and compassionate communication. The fourth and last comment is about the prompt adoption of the comments and suggestions of the patient. This is all for me, and I would like to end my slides with this question. If you can please participate in how many patients and how many patient empowerment strategy mentioned in this webinar is implemented in your organization. So if you don't have any, it's okay to just choose 0, or if you have 1 to 3, 4 to 6, 7 to 9, or if you have 10 or more, or if you have different strategies that are not mentioned here, please write it in the chat box. I really encourage you to participate in this question. There is no right or wrong answer. We just would like to know on how others are doing. Okay, so we have almost equal number for 1 to 3, 4 to 6, which is very good. 7 to 9, excellent. For those who have 0, I think it's after this session, hopefully you will have some ideas, or you'll inspire some ideas or projects to implement at your organization. Thank you so much. And now, as I shared with you, lessons learned from our hospital in terms of national level, it's time to get back to Ms. Makia to share lessons learned from the Saudi Patient Safety Center on national and international levels as well. Thank you.
Thank you so much, Hala. We are really proud for this huge achievement and dramatic change have been just done in a few months. It's our turn now to share with you the initiative which called Patient Safety Caravan. Actually, it's a virtual caravan which consists of a group of volunteers and medical students who were trained before visiting those patients, and we were giving them materials about how to encourage patients to ask the right questions when they are encountering with healthcare providers. This idea really impacted a lot of countries, and we are going to implement it also with Southeast Asia during the coming year with WHO as well. So we have piloted this initiative in different cities around the kingdom during 2018 and 2019. And the target group definitely were the patient and the medical student who were volunteering in different cities, and the quality and patient safety directors were the stakeholders and the supporter in the hospitals to achieve this caravan. And the outcomes definitely is really important for your leaders when they are asking, what are the outcomes of this caravan? So we come up with above 3,000 patients and 244 numbers of volunteers and almost 900 hours of volunteering in 6 cities. And these are different photos from different cities in the kingdom, and Riyadh, Jazan, Jeddah, and Mecca, and Qasim as well, and Riyadh. So when we saw this impact from the patient safety caravan, we just transfer the knowledge to WHO, who agree with us to being a collaborative center with WHO. We piloted also in Pakistan, and they translated the materials into Urdu, and the outcomes and the lessons learned were really huge, that they can see that patients they can speak up and they can just address the correct questions. And usually patients are very silent and very passive, but even when they want to ask their healthcare providers, they don't know what are the right questions, and sometimes they are ashamed. So just supporting them with the right questions, it was a good solution. And also Pakistan come up with 800 number of patients and 24 trained staff and healthcare providers in the 3 hospitals. Actually, we just shared this SPSC initiative regarding patient empowerment being an empowerment tool. And we come up now with the last polls. Thank you, Heba. Just coming to the end of the session, and we want to rely it to the patient safety. Do you think the number of potential roles that patients and families might play in patient safety, do they can help to identify adverse event? Can they help inform clinicians about the adverse event they are not aware of? Can they behave as advocate for their health, or none of the above? We are encouraging all the participants to participate. So we are almost done with our session today. Coming to the last session, which is the panel and your questions as well. So how do you think patient empowerment and engaging patient could help? And okay, thank you, Heba, for sharing the result. So we have 15%, they think that engaging patient could identify an adverse event. 47%, they think that they could inform the healthcare providers about things that they are not aware. 38, which is interesting, believe that patient they can behave for their health. Thank you so much for your participation. And we are going now to move to our last part of last session. I just want to thank my colleagues, Mr. Abdurrahman, Mr. Khalid, and Mrs. Hala for this informative information. And really, we enjoy the different initiatives and strategies among our speakers. And we could just now have our questions from you participants. We have some questions. So we could just ask Mr. Khalid.
Yes, Ms. McKay.
Okay, if you can just put your mic on, we have different questions for different speakers. Just give me a few moments to gather them all. So let me start with you, Mr. Khalid. How do you think of that we have a lot of participants speaking about or writing, sorry, about the challenges when it comes to implementation of BFAC? Being you monitoring and oversee this from Ministry of Health, what are the challenges that come from the clusters?
Thank you, Ms. Makia. One of the main challenges that our colleagues faces can be the regularity and holding the patient and family advisory council for many reasons. During the era of COVID, yes, we have made this challenge was number one, but also what we call the commitment from some patients. Sometimes they just I wouldn't say disappear, but we could refer this sometimes, or we could refer it to if we are really of those patients. Let's say one of the reasons we are anticipating here the causes or reasons why those patients just stop coming to those meetings. We could say the confidence on those patient family advisory councils. We encourage. I think one of the things that we have shared and during my part here in this session was ensuring the regularity of those meetings. Number one. Number two, making sure that all goals and all discussions were I mean, the participation of those patients was really active. The patients and their representatives were really active on those meetings. There were no type of authority. So the CEO, let's say any of the hospital executive board has no type or they don't practice any, or patient do not sense any type of authority there. So I feel this is one of the main reasons, aside from the regularity, which has which COVID-19 has played a role there of stopping some of the meetings. So this is my belief, and this is what we came across during our experience in the patient and family advisory councils. But still, this is not the whole thing. I think we have many positive experience and many initiatives that came out because of those meetings. Thank you.
I think so, Mr. Khalid, that we have a diversity and we have different needs and demands from different cities. So I think each facility and each city has their own challenges and they could just deal with it accordingly. So moving to Mrs. Hala, with the same topic, the BFAC, we have a question from our participant saying that, is there any specific criteria in choosing council members? How did you ask and recruit members to join the council? For example, whether by phone or interview, and how you can make sure that the member in advisory council, they are really represent the patient who live within the community.
Okay, thank you, Ms. Makia. This is an excellent question. So I'll share with you our experience. Initially, we have recruited patients randomly who has like frequent visits to the organization. And some of them were really representative and they got the concept behind of the PFAC, but we faced some challenges with the rest. So after that, we decided to make it more structured, to create more structured way to recruit patients. So the first way was distributing like signages or posters across all the hospital, like at the nursing stations, at the main entrance, in the wards, that if you have any idea, you are welcome to join the Patient and Family Advisory Council, and we included the contact details. But after that, we will be interviewing the patient and to understand and let them understand that the concept behind of this PFAC. If they have an idea or a point to share with the team, so this patient will be recruited. If sometimes, as mentioned, they will just share with us their personal experience, or they want certain thing from our side. So this will, of course, not be part of and will not be representative for the majority of the patients. So a quick interview, like 5 minutes, 10 minutes, just to understand the level of understanding and what's the point behind the patient's interest to join this committee or council.
Thank you, Hala.
So in brief, yeah, distribute the signages and or posters, but after that there should be a quick meeting or interview with the participant or applicant.
That's a great answer, Hala. Moving back to you, Khalid, there's a question from UAE. They are asking if it is possible to get the BCC and BX standard and practice to implement them in their facility.
Yes, of course. The Saudi patient-centered care standards are published on the Ministry of Health website. And I think they can easily access those standards. And if they can apply them in their context, we welcome that. We have no issue with that, and we would like to hear from them about successful story. Hopefully, inshallah.
Thank you. Exactly. We are here to share and learn lessons learned and share experience as well. I have a question to Mr. Abdurrahman. If you can just unmute.
Absolutely. Thank you.
We have a question about what means do you choose a care partner, and what level of care do you assign them?
The care partner, I think this questions, it goes to Mr. Khalid. I think the care partner as also to Ms. Hala, because they are working on Plane 3 standard. But from my point of view, the care partner can be chosen based on the patient nomination. Like the patient, he would like to be one. There is one of his family as a care partner. He can choose that. It's not based on the healthcare providers or the organization. It's based on the patient's opinion. It goes to the patient. He can choose the care partner that can knows about his condition, about his health status, and about the treatment plan. So he can help the health providers inside and outside the hospital to complete the treatment plan. So this care partner will help us to provide a professional and comprehensive, safe healthcare services. I'm not sure if Khalid or Hala can elaborate more on this, but the choice is the patient, not for the organization. The patient can choose the one who will disclose his condition or the treatment plan.
What do you think, Mr. Khalid and Mrs. Hala? If you could just add.
Yeah, exactly. What Mr. Abdurrahman mentioned is absolutely right. So upon admission, we provide this preference card to know what matters to the patient. One of the questions is to ask the patient about the care partner. Who do you want to be your care partner, and how important is it to you? Like, shall we involve him and engage him in everything, or to what level we should engage the care partner? It's up to the patient, of course. And this care partner will be, we have a weekly session conducted in collaboration with the nursing services and health education. They will invite all the care partners within the hospital and provide them with some orientation and education lecture on how to take care of the patient and how to participate with us as healthcare workers and what's their role.
Thank you. This is awesome. Mr. Abdurrahman, I will just go back to you and asking you about the Ihsan initiative. How does it impact the staff engagement and patient engagement as well?
Okay, actually, Ihsan was initiated based on the feedback from the patient experience measurement program that we have found the communication and courtesy, and in the comments we have found some negative comments about the communication way that the healthcare providers do with the patient. So we have initiated this initiative to try to improve the communication and the way that the healthcare providers treat the patient, as we have seen in that card. And so we recommended this card printed out, and healthcare providers can hang it with his ID, and they can put it on the table, on the desk in front of them, to remind them that to smile, to ask, to respond quickly to the patient, and answer their questions, and appreciate their waiting, and appreciate their time. So we did find that through the comment. After implementation of this Ihsan campaign, do we have improvement? I would say yes, but we couldn't say it's based on the Ihsan campaign only, because hospital, they have another initiatives and another projects that was initiated to overcome these challenges and face the patients. But Ihsan, one of them, we are sure from that, because we have also initiated a comment box in the PX measurement program to ask the patient if he appreciate one of the healthcare providers. Also, we have seen many comments after that about the communication and the good communication they have received in the healthcare services, and about the courtesy, and about the care they are getting from the healthcare providers, especially those in hospitals who implemented the person-centered care, like King Faisal Hospital Complex and Prince Mohammed Abdulaziz. And also we have met many employers in these hospitals or healthcare providers. They also talked about these initiatives and how it improved their communication skills. So we are sure that these initiatives, it has impact, but not one initiatives can do everything for us, but with another initiatives, with another projects, with more efforts, we will get successful healthcare services.
Totally agree, Mr. Abdurrahman. It's really not one hand that we could clap, but it should be on a collaborative efforts. I would like to go back to you, Hala. There is a question, I think it's really related to healthcare facility. How can we select patient for participation in the improvement project? Have you gone through any improvement project that patients were a member?
Again, yeah, it's the same. Almost it's going to be the same answer with the for the PFAC, because any improvement project will go will go through the PFAC and will be discussed through the PFAC, and then we'll work together with the patient. So depending on the idea that the patient have, or another way is, for example, if one of the departments within the hospital, they have a certain issue and they have they want to do some improvement work, we can invite, or they can, from their clients, they can invite and involve some of their patients to be part of this project. And it will be, again, through the PFAC. All improvement projects in collaboration with patients, it will be through the Patient and Family Advisory Council. So it's both ways, either from, if it's coming from the patients, or even if it's coming from staff, we will be involving patients because they are the end users of the service.
Definitely. Thank you, Hala. Thank you, Mr. Khalid and Mr. Abdurrahman. I think our participants, we are now coming to the end of the session, and we could just summarize that patient empowerment is the cornerstone in patient safety for better outcomes in the healthcare system. Strategies are in place, for policymakers, stakeholders, and lessons learned as well, but we have to believe that this is a priority. Staff engagement is related to patient engagement. Thank you, and back to you, Heba.
Thank you, Makia. Now that we reach the end of our journey, on behalf of the Saudi Patient Safety Center, we would like to thank you, dear speakers, for this enlightening and informative presentations. Many thanks also to our dear audience for their active participation. As part of the Saudi Patient Safety Center's efforts to provide you with a timely topics and interesting speakers, we would appreciate if you would fill out the evaluation survey provided at the end of the session. Thank you for joining us today, and we look forward to welcome you back in future webinars.